with Digit Medical. Victor Schwartz is also here with Digit Medical, and we have two more team members who are coming later today. And before I start the pitch, I just want to thank ATI SEAL and all the mentors here for this amazing opportunity. We're really excited for the summit. So I want all of you to picture this. So over the past several months, let's say your hand has been going numb, it's been bothering you, it's been waking you up at night, and over the past week it's gotten to the point where you decided you need to see someone about it. So you contact your family doctor, you set up an appointment, you meet with her, and you discover that you actually need to see a specialist and are referred to a local orthopedic surgeon. So you call the surgeon's office, you talk to the scheduler, and you set up a consultation. And after meeting with the surgeon, you discover that you have a condition known as carpal tunnel, one that needs surgical treatment and another appointment. So you talk to the scheduler again, and you discover that the first available time to get treated is 3 weeks away. So after waiting, you get treated, and your carpal tunnel is fixed. But when looking back, you had to wait weeks just to get treated. You had to meet with multiple doctors, and you had to spend hundreds of dollars in the process. And unfortunately, this is not just an isolated scenario. This happens to thousands of Americans all over the country every year with a whole host of conditions. Overall, this whole process of diagnosing and treating patients is antiquated and inefficient and needs to be improved. So that's where we come in. I'm going to go through this whole process again, but this time with the use of our software to explain how it works. So after speaking with the family doctor, you were referred to your surgeon. So you call the surgeon's office to set up the initial appointment, where you are referred to our website. So before arriving, you go to our website where you answer a series of questions about your condition. Now, this is not just a typical form that you typically fill out about your history, about your insurance, things like that. This is an intelligent question engine that asks questions specifically about your condition to pull information about your symptoms. This information is then sent to your surgeon, allowing her to make a preliminary diagnosis on the condition that you have. What's so powerful about this is that she's able to prepare the necessary tools in medicine to potentially treat you on your very first visit. So as the patient, this means that you can cut down the number of times you visit the physician and get treated faster. You can save money by avoiding additional visits. And then for the physician, she's also able to provide a higher quality of care to her patients, and she's actually able to make a higher margin on the time she spends with her patients because more of that time is spent actually treating them. So to reiterate, the software that we're making asks targeted questions to patients about their condition to pull information about their symptoms, and then it sends this to their surgeon before they even arrive at the office. So we plan to monetize this by actually offering this service free to patients. It's the surgeons who are going to be paying this, and they pay a fee, a very small fee for each patient that uses the software. So with this comes two different points of intellectual property. One is the very question engine itself. Over the past several months, we've been working with two orthopedic hand surgeons out of Dayton, Ohio, to create question trees for some of the conditions that they have. What we found is that even though there are many, many different cases that they see, many of the patients they see actually just have a handful of different conditions. And with each condition, there are several unique symptoms for each condition. So what we've been able to do is create a question engine that's both efficient and accurate. And as we start testing it, we plan to continue to modify the questions that we ask patients to make it even more accurate. And then, of course, we also have a tool through Neo4j. It's a relational database for creating new rules for creating new condition or questions for new conditions. So, of course, we realize that for surgeons, one of the most important things they do is actually diagnose patients. And we want to provide provide them this tool to help empower them to do so. So with this tool, this allows them to add more content to the question tree, but then also modify it if they would like to add a question or change the wording of the question. So right now, here's a diagram of the competitive landscape. We see it kind of breaking down into 3 categories. There's telemedicine. These companies help facilitate interaction between doctor and patient. They set up e-chats, virtual messaging, things like that. There's also information services. I'm sure all of you are familiar with WebMD. It helps provide information to patients about their condition. And then there are also electronic medical records, such as Epic, that help house information about patients' medical history. And we kind of see ourselves falling in between the telemedicine sector and information services, where we help facilitate online interaction between patient and doctor, but we do so more in an intelligent fashion. So for the market opportunity, it's very exciting right now. Over the past 5 to 10 years, we've really seen a growth in the application of technology to medicine. Specifically for telehealth, there's a calculated annual growth rate of about 18% between 2012 and 2022. And as I've said before, the surgeons we're working with, they're orthopedic surgeons, so we first plan to focus on orthopedic outpatient centers, which is a market size projected to be at about $18 billion by 2022. And then all of outpatient surgery is projected to be about a $100 billion market. So our go-to-market strategy, right now, we are just about to start testing our software in a clinic in Dayton, Ohio, and we are speaking with several other surgeons across the country. We hope to test the software in their clinics as well. And then after we continue to refine and we'd like to hopefully validate the idea this summer, we plan to continue to target other opinion leaders within orthopedic surgery within the next year, and then hoping by the end of the year to potentially launch the product to all orthopedic surgery centers across the country. And then just overall, we'd like to further develop and add content to the question trees so that we can go beyond orthopedic hand surgery. We'd like to expand all orthopedics and other fields within medicine, such as dermatology, potentially sports medicine. So here's our team. The 4 of us are actually from Duke University. We major in computer science or biomedical engineering. We've had some experience in the past with different competitions. We also have been a part of startups in the past, and Satchel's actually in the past helped run an e-commerce website. And then these are the 2 medical advisors we've been working with, Dr. Martineau and Dr. Bamberger. They are very progressive within their field within orthopedic hand surgery, and I've had the pleasure to work with them over the past several months in refining the question tree and refining the idea. I think that's it.
Go ahead, Ryan. Yeah, I have several questions, but I'll start with one. This basically helps with scheduling and getting people in quicker and stuff, right?
It's not so much a scheduling tool. It's more to help cut down on the number of times a patient has.
So what I was going to bring up is that it seems like your medical advisors are the people who, a patient comes in front of them and they see who's in front of them. I don't know how in tune they are with this process itself. So are there better people you could be talking to be consulting with to figure out, what's going on?
I think other than talking to the surgeons themselves, I think it could potentially be helpful to talk to maybe administrators or...
Because they'd be the ones who would be interacting with this, right? Not the surgeons?
Yeah, but we actually have talked to the schedulers who help set up patient appointments. I spent a day talking with them, and so they are also familiar with how the whole process works. And actually, Dr. Bamberger, he's the one who started the outpatient surgery center, so he's actually very in tune with the business side of how it works. He's not just purely a surgeon, he's one of the partners there as well.
So how did y'all land on county and surgery?
Yeah, so back several months ago, first semester, we were talking about different business ideas we had in the medical industry, but we wanted to talk to professionals. So we actually got in contact with these two hand surgeons, and I've been working with them ever since.
How do
And
you know they're not just really super progressive compared to all the other hand surgeons out there? How many other hand surgeons besides these two talk to as to the real need for this type of arrangement?
yeah, we've not talked to a large number. We've talked to several others. We've talked to an elbow and shoulder surgeon. We've talked to other surgeons out of Missouri. But that's, I think, one of the things we really want to do this summer is try to talk to as many surgeons as
It's
possible.
a really conservative group to go after to begin with. So physicians in general, they'll want to always double check everything. I know if you've been to your physician lately, first of all, the nurse checks everything you fill out on those forms or any other forms. Then he or she will go over the forms again. I can't imagine somebody doing surgery without actually double checking that it's the right hand we're talking about.
Yeah.
Third particle, and they're going to believe software that points out this stuff to them without them double checking it. I mean, it's a difficult.
I
So that's
completely
why
agree.
we're pressing on lots of other physician types or other hand surgeons. Really find out if there's a real need in your space.
And just to clarify really quickly, we don't envision sending the information and then as soon as the patient arrives, treating them. We definitely see when the patient first arrives, the surgeon goes over the questions that they answered and makes sure that what the patient provided is correct so that they aren't just going blindly into treatment.
So I understood this as a pre-diagnosis tool, mostly. I was wondering, in a team of 4 computer scientists and 2 advisors coming from the space, who's really building this enormous database of questions and conditions, which is pretty much the secret sauce, if I understood. And the second part of my question, if there are any liability issues, something happens and then the surgeon blames you actually, not yourself, something going on.
Okay, sure. So to address your first question, the two surgeons we're working with are the ones who actually have been the main contributors in the whole question trees that we've assembled there. We're using their medical expertise and their experience within this field to help develop those question trees. And then if we ever expand, I talked about the database earlier, the tool that we're creating now to help surgeons easily add more content in the future. So a lot of the actual content will be provided by the surgeons themselves. And then liability-wise, a big thing for us is HIPAA compliancy, making sure that this patient data is protected and it's encrypted. And that's one thing. One of the things we've worked a lot on already. We've done a lot of research for that. We've talked to an IT professional who deals with HIPAA compliancy a lot. And so we're taking the necessary measures to encrypt the database and the transfer of information.
Sorry, maybe I didn't report. I'm not sure what you meant for this, but I have this and then there's something going wrong in the medical procedure. And then the
Yeah.
saying, hey, it's not because of my fault, because of the information you guys passed along.
We have a minute left.
Okay, yeah, that's a good question. So we're not diagnosing the patient. We're more sending information about the patient to the doctor. And whenever a doctor joins the site, we will have them sign terms and conditions that make sure that they acknowledge this and that it's really them who's making the actual diagnosis and they're the ones responsible for treating it. It's not us. Sure.
So I think I may be correct here, but I think that WebMD is something that a lot of doctors don't like. Because a lot of patients pre-diagnose themselves, and so. But the thing, the power of WebMD is that it empowered people to have information. And so I think from a go-to-market strategy standpoint, if you're approaching
20 seconds.
They aren't conservative, but what they are is they may be progressives in resisting change. And so I think that if you sell this as the reverse of WebMD, as this is actually going to allow you to do the thing that these patients are trying to do themselves, then I think you may have something there because if you use this as a way to kind of cut out WebMD from the process from the patient standpoint, then I think that the doctor may be more likely to accept that as something that's their own. So that's what I would recommend.
Okay. Thank you.
Yeah, we're out of time. Thank you.